Hello, I'm Dr. David Wilms. I am a pulmonary and critical care medicine physician practicing here at a large regional medical center in San Diego, California. I have over 30 years of experience taking care of patients with a variety of respiratory illnesses, and along the way have used a number of medical devices to support them. Today I'd like to introduce you to a new product, the HFT 150, which is a device that delivers high-flow nasal oxygen therapy for patients who have respiratory disease. High-flow nasal cannula oxygen therapy has become an important tool in our set of devices to treat patients with respiratory illnesses. Over the last couple of decades, we've seen a drastic increase in the use of high-flow nasal therapy, especially in patients who come in with acute hypoxemic respiratory failure, meaning their blood oxygen saturation is low. There are a variety of patients who can benefit from high-flow nasal cannula therapy, including patients in heart failure, patients with pneumonia, and selected patients who have chronic obstructive pulmonary disease exacerbations. What we've seen, especially in the last decade, is that a number of patients treated with high-flow nasal therapy are able to avoid intubation and be treated with a less invasive form of support. The optimal candidates are patients who are pediatric or adult age, who have a illness that presents with low blood oxygen levels and requires higher levels of support. The way high-flow nasal oxygen therapy works involves several characteristics. One, the high flow of enriched oxygen into the oral pharynx flushes out carbon dioxide and improves the efficiency of ventilation being breathing. The higher levels of delivered oxygen to the oral pharynx allow us to improve blood oxygen levels in those patients who are sick and have low blood oxygen levels to begin with. And there's a small amount of positive airway pressure that's delivered by the high-flow oxygen device that for many patients improves their physiology and ease of breathing. Some of the other benefits of high-flow nasal cannula oxygen therapy have to do with the way that the device is set up and oxygen is delivered. In this case, the patient's wearing a nasal cannula and not a mask that covers the face, so that allows more comfort, freedom from claustrophobia for some patients, and the ability to talk and communicate and eat even while they're receiving the high-flow nasal therapy. In addition, because high-flow nasal oxygen therapy is warmed to body temperature and humidified, that improves the comfort level of the patient and also may help with mobilization of secretions in these patients who have some secretion problems. As a clinician treating patients with respiratory insufficiency, there are a number of features of the HFT 150 that I find very appealing. Firstly, the user interface is very simple, easy to read, and you can detect the flow rate, the FiO2, and the temperature of delivered gas readily at a moment's notice. Additionally, changing those settings is very intuitive and easy to accomplish. The device has several features that are somewhat unique, including the built-in air-oxygen mixer so that you don't have to have a separate device on a stand. It has an integrated water compartment for the humidification that is easy to take out and clean or discard and refill. And another unique feature of the product is the built-in oximeter. You can monitor patients' oxygen saturation during therapy, during transportation of the patient without interruption. And in addition, the device has a built-in battery allowing transport within the hospital for a period of time without having to interrupt high-flow nasal therapy. In summary, we're seeing a rapidly emerging role for the use of high-flow nasal oxygen therapy in patients with respiratory disorders. The HFT 150, a new product, offers a number of advantages in the use of high-flow therapy, and I'm very excited about using it in my patients in the future.